Hello, everybody, and welcome. My name is Sandy Stemp. I'm the Chief Operation Officer at RENA, and I'm very happy to introduce two folks also that you see on the screen today. One that you would have been hearing from, potentially seeing a lot of, which is Sharon Major, and he's our Communication Manager. And I know that you have been hearing a lot from Sharon and myself. You get all these emails and sometimes videos from ourselves. And this is another one which we hope that you'll find really helpful, and really happy to have Angela Gonzales with us today. I always call her Angie, so hopefully that's okay. And many of you potentially know Angie and have seen her. Angie has worked in our sector for many years. I'm going to let her introduce herself a little bit more. But one of the great things about Angie is just her great commitment and passion for people with developmental disabilities and the staff. Like, she has just really, all of you, I'm sure, who've interacted with her have been so impressed by her incredible motivation for the health and safety and for the healthcare of people with developmental disabilities. So the video today is really for all of you. We know that there's been lots of information out there about the COVID vaccine. One of the things that we really want to be at RENA is ready. We want to be ready for the COVID vaccine. And what this means is really providing you some good information, and also understanding that it's a challenging time, that you may have a lot of questions. So that's what we're here today. And Angie is going to be the wonderful person that's going to help us with those questions. So I'll turn it to Angie to say a few words about herself.
Well, thank you so much, Sandy, for the gracious introduction. It's very, very kind. My name is Angie Gonzales. I'm an advanced practice nurse based at Surrey Place, and I'm working for the Community Network of Specialized Care, which is a network of over 30 developmental service agencies across Toronto and the GTA. I've been very lucky to be able to do this now and for over the past 10 years and visit people with developmental disabilities and their teams in their homes. So over the years, I've been to many RENA homes and day programs, and I've met with teams of support professionals. Been very privileged to work with you. So I'm very thankful that I'm here today and talking to you.
So we're just going to jump right in there. So Angie, one of the things that people are worried about, because I think initially everybody heard it was going to take so long for vaccines to be produced, to be developed. And then suddenly it kind of seemed like, wow, they're here. And people are hearing, getting a bit worried about, is it too fast? Are the vaccines, that were created so fast, like, are they safe?
Mm-hmm. Well, this is, as everyone keeps saying, an unprecedented time. So the genetic recipe for coronavirus was published a year ago in January. And what we've been very lucky to have happen is a unique process where international research networks have pooled resources. They've been working together, collaborating with the goal of saving people's lives by coming up with a COVID vaccine or COVID vaccines. The research mechanism, the research on the mechanism behind the two vaccines that are currently being used isn't new. So the synthetic messenger RNA type vaccines that are currently being used, that mechanism has been researched for over 2 decades. So it's not a new mechanism, but certainly the COVID-19 vaccine, which is a messenger RNA vaccine, the two of them, they are new. And it's the result of a highly collaborative effort made across the world, basically, to save lives. And the process was also unique in that Usually Health Canada would receive the research, all of the research, all in one and packaged in one and at one point in time. But I understand that this process was made faster as well because research was submitted to Health Canada across real time as they came out, as the pieces came out. So the review process, that really helped. And the review process through Health Canada is extremely rigorous in order for them to approve and then issue the statement of the vaccines are safe. So the major and most reputable sources of information on the process and why it came out so quickly, that comes through Health Canada and also governing agencies like Public Health Agency of Canada and something called the National Advisory Committee on Immunization. So there are huge bodies, governing bodies that are working together and are issuing the statements on the safety of these two vaccines being used.
That's great. You know, one of the funny things is that whenever we hear about these vaccines, they use words like Pfizer and Moderna and some of these names, and sometimes you're wondering, like these big pharmaceuticals, like why do they have the name of the pharmaceutical company on them? And like, like you mentioned, they were collaborating. Are they competing? Or are they sort of packaging their own vaccine? Why isn't there only just one?
Yes, so they are, so across the world internationally, these research networks and pharmaceutical companies are collaborating with again, the goal of that this is about saving lives. It's not about competing. It's to collaborate to offer as many options as possible across the world. So the two fastest vaccines, Pfizer and Moderna, they are labeled Pfizer and Moderna, just like any of the medications that we use are labeled, so that we understand which drug is which drug. Similarly, we need to understand which vaccine is which vaccine. Because, for example, Pfizer and Moderna, they both use the same mechanism of messenger RNA, but they have slightly different ways of, for example, of storage, of administration, of giving the vaccine. And I think about it, for example, similar to how in our homes we give various drugs. We need to label them. They're pharmaceutical names and labels, and that helps us to understand which drug is which. Similarly, with the vaccines, we know Pfizer is slightly different from Moderna, and they're simply labels.
I guess it's similar because some of the medications we see on our medication administration records say APO, and that's because it's made by Apotex or Novo.
Right.
And so those are labeled like that the same way as Pfizer or Moderna. They're just newer to us.
Exactly.
But this sounds like the race of our lives, where you're going to create these teams of people and say to them, run as fast as you can, because every moment counts and every life counts. So it really does sound incredible. And maybe that's why people are worried, because unfortunately, we might not be used to people working together so fast. And with this, everybody around the world did, because it counted and it mattered. So that's
exactly.
Yeah. So one of the things too that we saw early on was people's worries about side effects, and initially there was a lot of information about allergies, like if you were allergic, and I think there were a few people allergic at the beginning that we heard about. And lately, I think there's been a lot on social media and some videos that people are forwarding or talking about that show people with a side effect, and that worries people. Should people be worried about side effects?
I would say people should not be worried about the side effects of these specific COVID vaccines, in the sense that there are safety nets, there are safety processes. And we need to pay attention to reputable evidence-based information versus hearsay. And also aside from, the aloof public health agency type reputable sources of information, some sources can be our trusted healthcare professionals. So it can be our family physician, our nurses, nurse practitioners. It can be our pharmacist, and your health team, basically. So things on social media are far removed, not evidence-based, and we need to focus on what is evidence-based, especially because, as you said, we're talking about moments that carry people's lives, basically. It's a life and death situation. So social media, paying attention to things that don't have as much evidence, that would get trumped by sources like your healthcare team and the public health agency information. In terms of side effects, adverse effects, each person should really check with their family physician or nurse practitioner about the safety in terms of their own specific underlying health conditions. The Ministry of Health consent form lists some of these conditions that you should check with your family physician or nurse practitioner about. And really, these conditions are also appearing on the consent form, but may in future be changed. So, for example, there were some people in the trials who didn't know they were pregnant and received the vaccine, the COVID vaccine, and then after realize that they're pregnant. They're being monitored through, again, the international research networks that are monitoring some of the people who that's an example, were pregnant or breastfeeding. And there's hope that from that data, they may be able to then change some of these conditions that are listed right now. So I think it's looking at specifically your questions about your own health or about the health of the residents, the specific conditions, and looking at the benefit of having the vaccine and not developing serious disease versus the risk of a smaller possible adverse effect, and balancing that, the benefit of not developing serious disease or dying versus what can be labeled as an unpleasant or a milder adverse effect. And I think it's also looking at, we're very lucky that there are many other countries ahead of us. So more than, I understand that, we're in mid-January 2021 and more than 35 million doses have been given in over 49 countries, and thousands have been, already received this vaccine. So there's a lot of data that's supporting the safety and what might be considered a milder sort of adverse effect.
I think that's really great. I mean, as you said, those numbers are staggering, like 35 million people receiving this vaccine. So even if you think about, some people commenting on a side effect, 35 million people. So, this is where the benefits versus the risks go like this. Like there's a huge difference in how much benefit, where we've really unfortunately seen incredible severity of disease, but also the fact that those people who got ill and survived sometimes don't survive to be extremely healthy. They sometimes have lingering symptoms for a long period of time, and they're not too sure what the long-term impact So becoming ill with COVID, even if you think that you're young, or maybe I don't have underlying health conditions, so I could take it if I ever got sick. I think there's so many risks related to becoming ill that the benefit of being vaccinated is really an incredible piece. So really, that's where, you know, behind Sharon's head, if you can see, we have we have our you know, really like this extraordinary opportunity that has, like, you know, this epic impact. So absolutely. I think the other piece that you know, it's interesting because people are saying, okay, well, you know, if I get vaccinated, it's not sort of the magic lightning bolt, right? That I get vaccinated and then suddenly I'm free. And so right now people feel like, okay, I've got this. I know my family and myself are safe. We know what we're doing. And when I go to work, I wear my PPE. And my understanding is what we've been hearing is when I get the vaccine, I still have to wear my PPE and I still have to do some of the same safety things that I'm doing at home. So if it doesn't change, then why would I get the vaccine?
Right. Okay. So I really love the analogy of PPE, the personal protective equipment, is sort of your external protection. And then possibly the analogy of PPE is external, but the vaccine, the COVID-19 vaccine, would be the internal protection. And so also, although we've received the internal protection, the COVID vaccine will help us to not develop serious COVID-related type symptoms and possibly death. We can still transmit COVID-19 on our hands. We can transmit COVID-19 on our skin. So using personal protective equipment, PPE is helping to cut the chain of transmission. Whereas the vaccine, it is helping to protect us specifically internally so that we don't develop serious disease from COVID, but we can still transmit the pathogen or the virus on our hands, on our, you know, on our skin, on our clothing. So we need to protect the people who we're meeting, who we're supporting, and not transmit to them. Also, if we look at some of the information from news and from reputable sources like Health Canada, the only way to stop this worldwide pandemic is a worldwide vaccination program. So herd immunity is something you've probably heard in the media, but there are people dying right now. And the only way to have that immunity in large numbers is to get the vaccine. But meanwhile, we need to stop daily sort of actions that could still transmit the virus to other people who are vulnerable. And that would be continuing to use our personal protective equipment.
It sounds like it will take us a little bit to get to that herd immunity. So we have to make sure that we're following everything so that we're protecting ourselves, people we support in our families. But it's worth it because the more and more people get vaccinated, the closer we are to living our lives the way we did before the pandemic. So that is awesome. Thank you so much. I always say to people that the vaccine is that light at that end of that tunnel. And we're in for still a bit of walk through that tunnel, but I think the vaccine gives us incredible amount of hope. I also think that for people like you, Angie, you really show us, and just even on your face, we can see it, that this amazing accomplishment with science and research that really has brought the whole world together. And, you know, soon with the vaccine and getting to the light at that end of the tunnel, we can all potentially move around again to see this beautiful world, right? So thank you so much for answering our questions today. Thank you so much for your commitment to direct support professionals and the people we support.
Thank you. It's a privilege.